Why is voice prosthesis maintenance so frustrating after laryngectomy? Imagine trying to keep a tiny, delicate valve working perfectly every day. That's what life is like for many people after a laryngectomy when they're relying on a voice prosthesis to speak. This small device is essential for talking, but keeping it working smoothly can be a real challenge. A voice prosthesis is a small valve placed between the windpipe and the esophagus. It helps air flow from the lungs into the esophagus so a person can produce speech. After a laryngectomy, this device becomes the main way to speak. But it needs constant care to stay functional. One big reason maintenance is frustrating is how often it needs cleaning. The prosthesis collects mucus, food particles, and other debris that can block the valve. If it gets blocked, speech becomes impossible. Cleaning must happen at least twice a day, sometimes more. It involves using tiny brushes, flushing with water or saline, and carefully removing mucus. This routine can take several minutes each time and needs good hand skills and focus. Leakage is another common problem. Sometimes the valve fails and lets liquids or saliva pass into the airway. This can cause coughing, choking, or even infections. If leakage happens around the device, it might mean the fit isn't right or the tissue has changed. Fixing this often requires help from a speech-language pathologist or doctor, who may need to replace the prosthesis or adjust it. Prostheses don't last forever. They usually need replacing every 2 to 6 months. Factors like diet, how much mucus the person produces, and how well they care for the device influence how long it lasts. Replacing the device isn't always quick or easy. It often requires a visit to the clinic, which can be frustrating, especially if the device fails early or leaks happen often. Physical ability also plays a role. Maintaining the prosthesis requires good manual skills, clear vision, and understanding of the cleaning steps. Patients with arthritis, vision problems, or cognitive challenges may find this very difficult. Struggling with these tasks can make maintaining speech even more stressful. When the prosthesis isn't working properly, speech is affected. This can lead to social withdrawal, feelings of frustration, and emotional stress. For many, speaking is a vital part of social life and independence. When the device malfunctions or becomes hard to manage, it impacts not just voice but overall quality of life. Managing all the tools and techniques adds to the challenge. Patients often need brushes, dilators, tweezers, and sometimes valve plugs. Learning how to use these tools correctly can be overwhelming, especially early after surgery. Some cleaning methods involve steaming or nebulizing to loosen mucus, which adds more steps to daily routines. From a speech therapy point of view, keeping the voice prosthesis working well is key to speaking clearly and fluently after a laryngectomy. But the physical demands, technical issues, and emotional toll make it a tough daily task. Speech-language pathologists help by teaching proper care, troubleshooting problems, and supporting patients through these frustrations. Their guidance can make a big difference in keeping the device working and helping people communicate confidently.